Good evening, everybody, and welcome to another edition of the South Florida Tribune podcast. My name is Scott Morganroth. Glad to be joined by Gary Kornbluh tonight. We have a great episode lined up. We're going to be talking about Medicare Supplement and Medicare Part D. The South Florida Tribune podcast is presented by Senior Medical Associates. And folks, let me give you an outline of what we have in store for you tonight. Gary obviously is our Medicare expert, does a lot of things with health insurance, so he's here to educate you week in and week out. And our main objective is, folks, is to put you in Aaron Rodgers mode. Go out there and relax. Take some notes. Play these broadcasts back. They're very informative. We had a very interesting situation over the weekend where I myself have a 215 license. And at Gold Coast, the school for insurance, I had an instructor by the name of Jerry Tyler who, when I told him about what we were doing, Gary, he said, "I love what you're doing, Scott. Keep doing it up. Our main objective is to go ahead and educate people, and that's exactly what we're going to do." So, folks, once again, take some notes, listen to the broadcast. Don't be afraid to listen to it again. And once again, the South Florida Tribune podcast is presented by Senior Medical Associates. I should point out before we get going, Gary Kornbluh can also be featured on Google. So, folks, you Google Gary's name and you'll find it. He's involved in this business for a long time. Gary, glad to have you back.
Hey, thank you, Scott. I appreciate it. And let me also say thank you so much to Senior Medical Associates who sponsor my podcasts, and they are truly the leaders in senior care. You can reach them at 954-659-9690, and they're just a wonderful bunch of professionals.
And we look forward to eventually doing a remote broadcast when the situation presents itself. And now we're looking forward to getting out there. Right now, we're focusing on making sure we've got to do. Timing has to be right. And our hope is to have one in person with them, especially before open enrollment begins. That's what our target is. With that said, Gary, let's get this bad boy going. And first of all, what is the best option for Medicare once you turn 65?
Once you turn 65, okay, you've got lots of options, but the very best option is just keeping original Medicare, Part A and Part B. And the reason why is very simple. You have access to the entire Medicare system nationwide. There's no networks, there's no referrals to deal with. Now, if you do that, Medicare typically pays, let's say, 80%. So now there's a gap of 20%. And that's why sometimes a Medicare Supplement is called a Medigap policy, because it's designed to cover that 20% gap and give you the 100% coverage. So that is the best option. And then let me just say on a side note, as long as it's affordable, because there is a cost associated with purchasing a Medicare Supplement policy. And then there are other costs too, which we can review as well.
Okay. So what are the costs if you choose a Medicare Supplement plan?
The costs are everyone that has Medicare, Part A and Part B. Well, Part A actually is free, and that's the hospitalization coverage. It's the Part B that you actually pay for. That's called the Medicare Part B premium. And this year it's $148.50. So that's actually taken right out of your Social Security payment. If you're collecting Social Security, it can be deducted from your payment. If you're not collecting Social Security yet, the government actually bills you on a quarterly basis. You get a paper bill. So the costs would be the Medicare Part B premium. And then also you would have, above and beyond that, you would pay a premium for the Medicare Supplement plan. Now, that's going to be based on your age and your gender and your smoker, non-smoker status, because they are medically underwritten. Let me also say one other thing. The other reason why Medicare Supplement is an important policy to buy when you turn 65 is because you have a guaranteed issue period where no matter what your medical history is, you're guaranteed to get a Medicare Supplement policy. Let's say, for example, you took Medicare Advantage instead, and let's say 2 years up the road, you decided that Medicare, original Medicare and a supplement was the better option. You might not qualify at that point because at that point you would be subject to medical underwriting. So that's another reason why if you have a bit of a medical history, you may want to start off with the supplement, and because you can always, your agent can always back you into a Medicare Advantage plan, because everybody qualifies for Medicare Advantage. But again, not everybody qualifies for the Medicare Supplement.
Okay. Very good. If I choose original Medicare and a supplement, will I be subject to a network or will I need referrals to see a specialist?
That is such a common question. People just do not like networks, and they like the freedom of being able to go really to any doctor, any specialist, any urgent care center, any hospital that's in the Medicare system. So you would not be subject to a network, because your network essentially is the entire Medicare system. Okay. And again, there's no referrals. As long as that doctor or that specialist or that hospital, as long as they take Medicare, which most of them do, then you can go. So no networks with Medicare Supplement.
Okay. So can I switch from a Medicare Supplement policy to a Medicare Advantage plan and then go back to original Medicare and a supplement?
Can you switch from a Medicare Supplement? So you have a Medicare Supplement, you're thinking of going, and then you decide to take a Medicare Advantage. And there are some reasons why people do that. Maybe they don't feel like paying that monthly premium for the supplement anymore. So you can do that, but here's the risk that you run. The risk that you run is, as I said previously, if you switch to Medicare Advantage, you can always return to original Medicare, but you may not qualify for that supplement if you're uninsurable, which would leave you with that gap again, that 20% gap. So you would Medicare Advantage at that point would be your only option if you were uninsurable. So yes, you can switch. The answer is yes, you can switch. You have Medicare Supplement, you go to Medicare Advantage, and you decide, well, really original Medicare and the supplement is really my best option. After doing much research, that's what you decided. And as long as you're healthy, you could qualify, you could go back to a supplement. Again, the problem comes in if you're not so healthy, you may not qualify. You may not be able to get a supplement again.
Okay. So do I get drug coverage when I sign up for a Medicare Supplement policy?
Okay, you do not get drug coverage when you sign up for Medicare Supplement. Medicare Supplement policy is just that. It supplements your original Medicare, your Part A and Part B. So you would have to purchase what we call a standalone Medicare Part D plan. That would cover your prescription medications. And the standalone Part D plans are, I would say they're somewhat similar. However, they do vary quite a bit in premium. So typically what I do is I'll instruct my client and I can direct them. But the best thing to do is to go onto Medicare.gov. And it's nice because Medicare lists all the plans out, and they list it from the most, the least expensive to the most expensive. So since the drug formulary is the same, regardless of the carrier, you typically want to pick a plan that, has the lowest annual cost, and with a good, and, if you're big on star ratings, you can search these by star ratings. But the bottom line is, if you purchase a supplement plan, you would definitely need a Medicare Part D plan, because here's another reason why you would want to sign up for Part D. Like the Part B, if you're eligible but you don't sign up, you could be faced with a lifetime penalty. Same thing with the Part D. If you're eligible for Part D and you don't sign up, you could be faced with penalties, late enrollment penalties. So you don't want to. You just want to sign up. And sometimes my customers will say, "Well, I don't take any medication at all. Do I still need a Medicare Part D plan?" And the answer is yes, definitely. Even if you take no medication, you still want to lock in that Medicare Part D. The premium will be low. You'll have virtually no co-payments. It'll probably be under $10 a month. But what you're doing is you're protecting yourself from late enrollment penalties in the future. Okay.
Sounds good. If I choose an original Medicare and a supplement policy, do I get dental and vision coverage?
You do not get Medicare Supplement, original Medicare or Medicare supplements do not cover dental and vision. Medicare, however, does cover certain dental related Medicare Medicare issues relating to dental. For example, God forbid you're involved in an accident and you had to have reconstructive or maxillofacial surgery, including the teeth. So major things like that are covered as a result of an accident. But typically dental coverage, just to get your cleanings and your fillings and your tooth extractions and your bridges and root canals, you would have to purchase a separate dental policy for that. And as far as vision, yes, you would have to purchase a separate vision policy. It's funny, I don't typically do a lot of vision because I don't really think they're worth the premium. I go to America's Best for $69.95 and I get my exam and 2 pairs of glasses. So I don't really think it makes sense to pay a premium for vision coverage unless it's part of a group policy. So that's just a little bit I figured I'd share with you.
Well, so you bring that up, and I'm really curious, and I know a lot of our listeners and viewers are as well. Would you, in your estimation, Gary, feel that vision coverage as well as dental coverage is overrated coverage?
Well, it's a cost benefit analysis, really.
Right.
And sometimes dental coverage can make sense in certain circumstances, but the problem is they don't cover very much.
Right.
They don't give you much of an annual benefit, maybe anywhere between $1,000 and let's say $3,000 per year, which is really not a lot of coverage, and yet you're paying a monthly premium to get this coverage. So some people just like to have it because they don't mind paying out monthly and then getting a little bit of help when they receive those services. Other people say, I'm going to skip the dental plan. I'll just self-insure, for my dental work. And you can do that if you have very healthy teeth.
Which leads me to my next question, one that a lot of people like to ask. And I don't like to get into discount medical coverage and all, because I know it's a separate animal, discount medical plans, however they're phrased. But sometimes individuals elect to go with those for these ancillary coverages like dental and vision as well. And then you wonder if that's just as efficient as it would be some of the insurance things that we're just talking about with dental and vision. So why don't you explain to our audience that as well, whether a discount medical plan would be advantageous in those specific areas?
Yeah, sometimes those plans can be advantageous, Scott. They can provide discounts for dental procedures and discounts for eyewear and in some circumstances discounts for medications. So yeah, they can be good, and the costs for those plans are usually very inexpensive. My feeling though is as long as your agent puts you in a good plan with good comprehensive coverage, you typically don't need those types of ancillary programs.
Yeah, but those ancillary programs are actually not bad, especially when you factor that they do involve multiple family members. So they're not bad plans at all. They're economical and they cover a lot of those other things that undoubtedly may not be covered. But it's a good thing for a lot of the average individuals to know that they're there. There's an advantage to those things. You just have to know where to incorporate that. So
right.
With that said, let's transition over to how does a donut hole work? I know that I've had cousins that are on the Medicare program that talk about the donut hole, but Gary, why don't you go out there and get into more specifics about it?
Oh, okay, the donut hole. That's a little bit of a controversial subject. Well, here, let me just explain it this way. There's 4 drug coverage phases. There's the deductible phase, the initial coverage phase, the coverage gap, which is called the donut hole, and then the catastrophic phase. So briefly, I'll just tell you, the deductible phase, as it sounds, that's where you pay up to your deductible. This year, it's $445 for annual deductible, and that's the deductible phase. So once you've paid that deductible, you then pay your co-payments for your medications. Now, having said that, let me just tell you that tier 1 and tier 2 medications are usually not subject to the deductible, and usually it's only zero or a small copayment at the pharmacy for the tier 1 and tier 2 medications. Now, the initial coverage phase is the second phase. So in the initial coverage phase, this is a little confusing, but once you and your plan have spent $4,130 between co-payments, co-insurance, etc., then you enter the coverage gap, otherwise known as the donut hole. So again, it's once you and your plan have spent $4,130, enter into that donut hole. Now that's where you're just going to pay a flat 25% for both generic or brand name drugs. Now, it was said that the government got rid of the donut hole, but they actually didn't. They just modified the donut hole. They didn't get rid of it. The donut hole, it used to be when you were in that coverage gap or the donut hole, you would pay 37% for both generic and brand name. They brought that 37% down to 25%, which was a tremendous help. But they didn't actually eliminate the donut hole. They just brought the percentage down in that coverage gap stage. Once you've actually spent, and this is just you out of your pocket, once you spend $6,350 in out-of-pocket costs, at that point you exit the donut hole and you go into that last phase, which is that catastrophic coverage phase. Once you're in that phase, your costs go way, way down. You only pay 5% of the total drug cost. Okay, and that is the donut hole. It's confusing. I would say the best thing to do is do a Google search for 2021 donut hole, click on images, and there's a lot of nice little charts that you can look at to further explain the donut hole. But that's pretty much it. Now, I would say probably less than half of the people ever really have to be worried about the donut hole. It's really for those people that take those very expensive tier 3 and tier 4 medications, even tier 5 in some cases. So that's where that donut hole comes in. That's where those really high costs of medications come in. And that's when you get caught in that donut hole. So hopefully in the future, maybe Big Pharma will help to reduce drug costs over time.
Yeah, that leads me to my next question. Thanks. You brought up a very good point, Gary. When you talk about medications, they can be broken down in two ways. The actual medication and then the generic one. Why don't you give everybody out there a little bit more of an overview about what the difference between a generic medication is versus the actual one itself? It'd be like me comparing a soda, at a grocery store versus Diet Coke versus the actual store model. But I think this is a very simplified analogy when you compare and contrast medications. Do they have a lot of the same chemicals in them, but just worded differently?
Well, the generic, first of all, there's brand name and generic.
Right.
Okay. So brand name drugs typically have I believe, a 7-year life from the time they're approved by the FDA, which basically means, I believe, I'm not an attorney, but I believe the patent runs out at that point. And then other generic drug manufacturers could come in and start manufacturing that same compound. So it is actually the same compound. Now, many people feel that the brand name drugs are better. Maybe there's more quality. They feel that there's more quality control. I don't know how true that is. I mean, plenty of people take generic medications, and I believe that the compounds exactly the same. But in many cases, people prefer to take, people actually have told me many times that they feel better they can't take the generic, they can only take the brand name. And that may be the case, I don't know. May or may not be, but in any case, let me just say that most people are just fine with generic medications, and they can end up saving quite a bit in co-payments by taking the generic equivalent
But
of
it's
the
good.
brand name.
But it's good that you can give everybody, Gary, a very generalized understanding when you compare and contrast the two, so that everybody understands either exhibit A or exhibit B. And that's what I want a lot of folks to try to digest with what you're telling them. Generic or brand name, either way, is probably a matter of preference and choice, probably even peace of mind, I would say.
I would say try the generic. Ask your doctor if he can write you a script for the generic equivalent. You'll save money, and chances are it'll work just as well as the brand name.
Very good. Okay. So how can I change my Part D drug plan if I'm not satisfied?
You can actually change your Part D plan, your Part D drug plan. You can only change it once a year though. That annual enrollment period comes around every October 15th and runs to December 7th. It's called the AEP, which was another podcast you did, right? Where the annual election period, some people call it the annual enrollment period. But in any case, it's that 45-day window where you can actually review and change your Part D drug plan if you want. And these plans do vary slightly each year. So sometimes I actually do change my my clients from one Part D to another. But usually I think by and large, I think people stay with the plan that they have because they're very similar. Did that answer your question, or was there a follow-up to that question?
No, I think you covered it well. So the next follow-up I'm going to lead to, is there any additional help available for expensive meds other than the coverage offered by Part D, such as manu coupes, grant subsidies?
There actually are, yes. So as I said previously, there are some medications that are really just super expensive. You know, the tier 3s, the tier 4s, tier 5s. And again, we're faced with if you're a Medicare recipient, which we're talking about Medicare here, you're faced with that donut hole issue again, right?
Right.
Where you could potentially be out of pocket $6,350. So there are organizations that offer grants to help you pay for those expensive medications. Many times the manufacturer, if you go onto their website, you can get coupons, and in many cases you can get help. They have programs where they can help the patient with to handle these costs. So there are grants, there are subsidies. If you're a Medicare recipient and you have Medicaid as well, or even a low income subsidy, you could get a pretty good drug subsidy as well. So there is help paying for Part D medications. There definitely is. Now, I would say the most important is cancer medication. Cancer medication is very expensive. And there are a lot of organizations that can help people cover their chemotherapy meds. So, you know, there's a lot of wonderful companies out there that can help with these high costs of medications. That's a great question, Scott.
All right, Gary, do I need to renew my Medicare supplement policy or my Part D drug plan each year?
You don't need to renew your Medicare supplement. It'll renew automatically each year. You don't have to do a thing. The only thing you have to do is just keep paying the premium. That's it. And most of my clients are on auto pay, so that's kind of a non-issue. But again, you do not have to, Medicare supplement policies just automatically renew year over year. Your Part D, of course, as we just talked about, you can let those plans renew automatically. Granted that you're staying in the same plan, right? You just let that same plan renew automatically. Or remember, you can change it from October 15th to December 7th. You can also change that Part D plan if you see something that looks a little bit more suitable for you. Because many times people's drug formularies change, and maybe one carrier had a good plan last year, but because your drug formulary, the medications you take, have changed, that maybe another carrier may have a more attractive policy. And I just want to mention, on my last podcast, you asked me, we were talking about what's the reason why people would switch from Medicare Advantage, I believe, to
Right.
Medicare Supplement. And it was because one thing I failed to mention, one of the main reasons is when you're on Medicare Advantage and your doctor leaves the plan, most of the time you're forced to change Medicare Advantage plans, right? And find a plan that doctor's taking now, right? The reason why I'm mentioning this is with Medicare Supplement, that's a complete non-issue. Because remember, you have access to the entire Medicare system nationwide. As long as that doctor, that specialist, that urgent care center, that hospital, as long as they accept Medicare, you're in with your Medicare supplement, with your original Medicare and your supplement. And then don't forget your Part D to cover your prescription meds.
Well, I'm glad you had an opportunity to bring it up on this broadcast, Gary, because I know a lot of people probably wonder about that. And if you want to reach Gary Kornbluh, you can do so through us as well, South Florida Tribune at gmail.com. This is a South Florida Tribune podcast. My name is Scott Morgan-Roth, along with Gary Kornbluh. This broadcast is presented by Senior Medical Associates. We bring this to you. We ask you to go out there and subscribe to the South Florida Tribune YouTube channel. The main objective is we want to make sure you have an opportunity to get the alerts when a new show comes on here as well. And Gary does a really super job week in and week out, making sure that this is a very tough subject. It isn't something you're going to learn overnight. I can't emphasize enough, folks, okay, to go out there and listen to these broadcasts over and over. You will get something new out of it all the time. Gary Kornbluh is also a columnist for the South Florida Tribune. And if you want to read Gary's columns, you can do so at www.southfloridatribune.com. He has a drop down. His profile is on there as well. And he is all over the South Florida Tribune, which we are an online publication. If you want to follow us on social media, you can do so on Twitter at Tribune Now as well. So, Gary, I think it's important to let people know how they can get a hold of you. Go ahead, the floor is yours.
Okay, thank you so much, Scott. Best way to reach me really is my cell phone. It's on 24/7. It's area code 561-305-5949. Again, 561-305-5949. You can always reach me. If I don't respond, which is rare, you can always leave me a message. Also, you can go onto my website, www.medigapx.com, medigapx.com. You can click on my testimonials tab and see what many of my customers have said about me. Last, I just want to once again thank Senior Medical Associates. They take great care of my folks. My mom and dad use Senior Medical. They're wonderful. They can be reached at 954-659-9690. They'll take great care of your folks that are 65 and older. Remember this, these are a senior primary care facility, and they have 10 offices in Broward County. So thank you so much, Senior Medical. And thank you, Scott, for having me again. Looking forward to the next one.
Yeah, me too. And the one thing I want to emphasize, folks, that when you review these shows is, you're not only reviewing them for yourself, but you're also reviewing them for family members as well. So everybody can benefit by this broadcast. At some point, you're going to qualify for Medicare, but mom and dad, grandpa, whoever, this is all useful information to family and friends. So please pay attention to these broadcasts. Watch them from start to finish. Don't be afraid to stop and start this show, because I know you'll always get something new out of it. And again, we are very proud to have Senior Medical Associates as a sponsor for this show. Gary does a wonderful job. He's been at it a long time, And there's a reason why he's on Google. When people go ahead and Google his name, they realize that these videos are up there. And it's a good thing for him to do, because nowadays in an environment where it's impossible to get in front of people because of the COVID-19 pandemic, and some people aren't comfortable inviting anybody in, you know what? You can see everybody virtually on the internet. You got to realize that the World Wide Web is a powerful tool, which enables us to be able to make sure that we bring these shows directly to you. All you need to do is pay attention and try to do everything you can to gain as much out of these as we can. We enjoy bringing them to you time in and time again. And I don't feel there's a more qualified individual than Gary Kornbluh, who's able to process and give you this information. And again, folks, knowledge is power if it's applied. Remember that. And I know the one constant dilemma that we have to deal with, Gary, whether we like it or not, is the threat of COVID-19. Folks, take it seriously. COVID-19 kills people, okay? This is not anything political. Get the vaccine. Everything that Gary alludes to in these shows here, and not only is about Medicare, but, you know, we're talking about medications at any age. Anybody can get this virus. So, you know, you don't want to find yourself in a very complex situation. But Gary, any closing thoughts before we wrap it up?
No, not really, Scott. I mean, you mentioned COVID. I think you're right. I think people just need to follow the science, and you know, science is based on many years of evidence. So I think we just need to continue to follow the science. I'll be in line for that booster shot for sure, and I'm sure you will be too. So it's a very controversial subject, but just it's hard to know who's going to take the shot and who's not. I just hope everybody does.
Folks, another thing I should encourage you to do is not only when you watch this show, I want you to also look at Gary's columns. He puts a lot of hard work into making sure all the information is on there, because not only are these shows built on what Gary writes about, but it's just another way to reinforce the information so you process it in a lot of ways. So meanwhile, once again, we want to thank everybody for joining the South Florida Tribune podcast presented by Senior Medical Associates. My name is Scott Morganroth. Glad to have Gary Kornbluh on as our co-host. And, you know, Gary, I look forward to the next time that we go out there and do this. And I know you'll come back with some great information and topics. So we look forward to it. So meanwhile, on behalf of Gary Kornbluh, my name is Scott Morganroth. Thank you for joining us tonight, and we will catch you the next time. Good night, everybody, and please be safe.
Good night.